So happy to be here, treating anxiety and depression with an integrative sports medicine model. And I typically work with athletes, so this is going to be very sports specific, but the reality is most of our youth are athletes, and I work with athletes from age 8 to 40, and well, I've even had athletes that are older, depending on if they're a lifestyle athlete or something of that nature. So I think it's very applicable that we talk about, anxiety showing up in children and depression, and how if we address these things right away, we can really strengthen the nervous system to keep them from having negative, outcomes later on in life, right, with addiction and other negative habitual resourcing behaviors. So that's what's really important to me about getting to speak about this and share these case studies and these modalities. Okay, so just, quite a few kinds of credentials and trainings I've gone through, and just recently, I see I have that on there, as I just finished my PhD, so it's kind of exciting. I didn't realize I hadn't taken that off. It's been so long in obtaining that and really taking my training and education from my exercise science background, from my clinical social work, and then putting it together with these more advanced neuroscience, physiology-based modalities, and really getting some great results with individuals suffering from a range of mental health conditions. Disclosure, I work for myself, I have my own business, and this is all my kind of content here and my case studies, and they were obviously voluntary with respects to, we don't really know the names and some of those things of these case studies, but certainly they were not paid to have to do any of these things or anything crazy like that. This is just a clinic that I am having the privilege to work with individuals. So how do we really start in talking out? And I really do understand that many of people, let's see here, around the world, they understand neuroscience in either a very in-depth way or very, very simplistic, but this will probably be about in the middle here. And we really need to talk about this because I think it's really important when we start looking at interventions and why we're doing what we're doing, and giving the psychoed to our clients and their parents, particularly because I think that we look at the Diagnostic and Statistical Manual of Mental Illness here in the United States and other countries that utilize that, clinical tool, and we will just frame things as, oh, they're depressed or they're anxious or this. Well, what's going on with their nervous system? And so once we kind of look at what's going on with the nervous system, then we can really see what we can utilize to address those issues, and then clear up those mental health symptoms or lessen them to the extent that they're not impacting someone's ability to function and thrive in their life. So when I talk to my clients, and even a teenager can really understand some of this stuff. So going into the three brain regions, and we kind of talk about the primitive brain, the filler, and the outside thinking part of the brain. So going into that, I'll talk to individuals about how the primitive brain, so it's kind of like our survival, and it's going to be that subcortical region there, and it's really our unconscious reactions to the world around us, and so much of our behavior all day, every day is unconscious. And so when you start giving the examples to individuals about you're driving your car or riding your bike, and you really don't stop until you see indicators that would alarm to our system to be like, hey, we need to call to attention, that's a red light, we must stop. So many of the actions, we can't sit there and just say verbatim how we even got to someone's office or something like that. So really talking about how unconscious reaction out of survival there's some echo, is an aspect of our brain. Okay, so then going into more of the primitive brain, especially when we're talking to athletes. Again, I work with athletes, young adults, and so when we talk about what our primitive brain's responsibility is, it's really survival and protection, it's our fight, flight, freeze mechanism. And we'll get more into that and kind of what the symptoms look like with our fight, flight, freeze and talking about the Polyvagal Theory. But really, this part of our brain, this has to do with our five senses and just reacting to scenarios around us and keeping ourselves safe, right? So if a boulder fell on our head one time when we were walking under a cliff, we would certainly be in this predictive, unconscious, fight, flight, freeze state of mind when we're walking under that cliff again, just kind of on high alert and hypervigilant, making sure that the boulder doesn't hit us again. And that's part of the brain. Then our emotional brain, and so this is what, as humans, really separates us and can really start to rule our world, would be our emotional brain. And so the emotional brain can really trigger that primitive brain out of fear and or anxiety, kind of what we're talking about today. And then it can also, if something's very pleasurable, it can kind of override sometimes that unconscious alert mechanism of, oh no, that boulder's going to fall again. It's like, well, yeah, but I'm having a really good time at the bottom of the cliff, and I kind of don't even want to think about that boulder potentially falling on my head. And so again, our emotional brain again. So really when we're talking about, like I said, it can trigger the primitive brain to produce the fight, flight, freeze mechanism, but it's also an aspect of our brain that's responsible for memories. So when we start talking about particularly some of the modalities that I get into, if something's not very emotional, we typically don't really make like a memory around it. It's like something has to be pretty either upsetting or wonderful for us to really remember it. I mean, we take in so much information every second of every day. And then we start talking about the thinking part of the brain. So this is our rationalizing and reasoning part of our brain. And we constantly will sit there after something bad or traumatic happens and we reacted and we got very emotional about it, and then we'll just kind of try to think our way out of it. It's like, well, yeah, what if I'd done this, or what if I'd done that, or we're trying to think our way out of those feelings and essentially the fight, flight, freeze, but that doesn't really work effectively, even though we think that if we have fully thought about something, knew why it happened, that we won't react or it won't happen again. It's kind of this false sense of security we have with our thinking brain. Another thing too is this is really in our thinking brain when we're working with athletes, and Dr. David Grand, the creator of brain spotting, one of the modalities that I've been utilizing over the years, he really talked about how this is where our pre-movement movement is, and our reaction to stimulus, that's conscious reaction. But our primitive brain can essentially bypass this thinking part of the brain. And what that looks like with an athlete is, okay, so if someone crashed on a corner skiing and then they go down that same course again and they're thinking to themselves, oh, I'm not going to crash this time, but hey, their foot catches kind of funny on a divot of snow, and all of a sudden the body muscle guards and reacts through that primitive brain and stimulates our amygdala and says, oh no, fight, flight, freeze, we're going into battle, and they lose their form and crash again, even though they had told themselves, I'm not going to crash here again. But the body remembered it, and when the sensation was really similar, that primitive brain, the body reacted. So when we talk to athletes about doing this work, we really want to process fully those past negative experiences so that then our thinking brain and our conscious intention can have full control when we're out there trying to compete. So the five senses. So again, talking about how the amygdala is really triggered. And so when we talk about the amygdala in the brain, we talk about a pea-sized organ in our brain that becomes hypervigilant and can go ahead and produce cortisol when we are going through a very stressful negative experience, right? So our amygdala, some people call it like the alarm system in our brain, but it's going to stimulate our glandular system and get us to produce cortisol, or it's going to get us to produce oxytocin. So if it's a really amazing endorphin driving experience, then we will produce the good biochemicals as opposed to the bad ones. Cortisol, oxidative stress, cellular death. It's not good to have high level of cortisol, but Of course, through our five senses, this is how that occurs, right? So touch, we know that's oxytocin. Bad touch, that's going to be cortisol. So, you know, one or the other, we will make that decision. About 1 second is how quickly that takes to happen. And then when we start talking about, again, looking at the modalities that I utilize and kind of trying to integrate what we've just talked about, you know, the brain is about 60% visual, says the Mayo Clinic, and I've heard even more from some other sources, but really our eyes are one of our biggest alarm systems, right? And so just constantly keeping us safe, and we're taking in so much information from our eyes. I mean, even right now, I'm looking off into the distance. It's like there's big windows along here. Certainly if I saw a fire truck go by and those lights flashing, I would take in that information and have a little slight alarm in my system thinking, oh no, something bad's happening. So is the neighborhood on fire, something like that. So really, but that would not be under my conscious control. You know, that's coming in here. The 4 bits of information, we can only interpret so much, right? So 1 megabyte of information every second of every day visually. That's insane. And a lot to interpret and take in. And then the other aspect with taking in information, kind of like I said before, when we're making memories, they have to be emotional, or they have to be pretty impactful. So thinking of it in that way too, that when negative experiences happen, we are then kind of organizing the information based off other negative experiences, or even if it's a positive experience coming in, if we are organizing the information, we've had a lot of negative experiences, we'll automatically organize it as negative. So it's kind of interesting with consciousness. And again, our visual processing, same kind of thing, just such an unconscious reaction to things. And if I can't stress that enough, you know, with my athletes, of so much is going on outside of their conscious control. And if things have been negative, they're going to start to perceive things negatively. Their body's going to start to physiologically react negatively with a high level of cortisol, losing control, and obviously the arousal, right? So kind of what we're getting to here with talking about anxiety and depression, it's that arousal piece. And you know, there's a lot in sports psychology where we talk about cognitive anxiety and then the physiological arousal. Which one comes first, right? And do they feed off of each other? And there are multiple models for that. And I truly believe that the more cognitive anxiety, the more arousal, and then it comes up to an arc. And then as the cognitive anxiety goes down, the physical arousal goes down, because essentially it's our physiological reaction to us with our thinking brain getting that primitive and emotional area of our brain getting all activated to stimulate our heart rates and our respiration rates. And then, like with oftentimes with what we get with performance anxiety in athletes, they get shaky and their hands get cold and clammy and all those kinds of shock symptoms that we see. But yeah, so again, that organization, this is just that working memory. You know, we talk about all the, you know, aspects of how we're going to hold on to memory if we're going to remember something, making ourselves remember something. Typically, if there's an emotional component, we remember, in good or bad. And then the other interesting thing most recently is the anterior insular cortex. So they're doing studies at the consciousness, it's out of the University of Michigan, but they're talking about why we make a memory. And they were saying the same kinds of things with putting someone under anesthesia and then seeing that, you know, why we do lay down memory and why we don't. So they're kind of like writing that line of, you know, what gets in there, what doesn't get in there for conscious memory. And they were again and again seeing that the most traumatic things we create conscious memory to. It's kind of interesting. I guess until we get to a certain point, and we'll get there, and then you start to disassociate and disconnect because it's just too much. So then going into injuries and adversities. So what I typically see with athletes, because again, this talks more centered around athletes. I know many of the other speakers will talk about various different populations, and just understanding that when we have a life trauma, or the adverse childhood experiences, as we call them here in America, or just a physical injury, we then encapsulate and hold on to that those traumas, right? And we don't really know how to discern between the two. And that was Dr. Robert Scar's work. He's an MD neurologist who ran a brain injury clinic in Boulder, Colorado for years. He just most recently passed away, but very talented guy. He wrote The Trauma Spectrum and The Body Bears the Burden and the 8 Keys to the building blocks of the brain, and just some really interesting books that he really talks about how we hold on to this trauma within our brain and our body and even our fascia. And that kind of starts to get into Dr. Peter Levine's work with somatic experience of understanding that our body has a memory. We also talk about then activating the amygdala, which resets our homeostasis, which are level of how we are functioning all the time physiologically. And so over time, we encapsulate and hold on to all these trauma memory networks within our brain and our body. We have made our amygdala so hypervigilant, just kind of ramped it all up to where homeostasis is always in this kind of hypervigilant, worried kind of state. So then that starts to translate when you're looking at the DSM into some of these anxiety symptoms and some of these, perceived potential anxiety and risks that maybe we wouldn't have gotten to that point had we not had these negative adverse experiences prior. So very important. And then also when we talk about our vagus nerve, which is our 12th cranial nerve, and is really responsible, as we found a lot with the concussion literature, when we're looking at athletes and sports performance and recovery from concussion, we've actually found that the vagus nerve becomes weaker after we go through trauma. And with the head injuries, we have found even that the gut motility, the smooth muscles in the gut, actually shut down within 24 hours, is what Dr. David Musnick, he's a triple board certified specialist within brain injuries, and so he's done a lot of work with this because he does microcurrent, right? So he does this kind of frequency specific shocking kind of technique to work on an individual's vagus nerve and gut motility following trauma. And so really he saw very specifically with head injury, but also other types of trauma that our vagus nerve becomes weaker and our gut motility shuts down. And of course, then this is going to negatively impact our mental health also, right? Because this is where most of our feel-good chemicals are essentially produced, is in our gut. And they talk about that gut-brain axis between the gut and the brain and how that slows that traveling of that microbiome positive brain chemicals, and then our wonderful immune system, right, within our gut. So a couple pieces there also when it comes to trauma, that it is just not great because essentially we weaken our vagus nerve, and that can contribute to anxiety and depression. And then also, so this is another kind of concept too that we look at when we go through trauma, is that the dura mater sheath around our brain and our spine actually tightens. And so this is Dr. Bruce Davis. He's a chiropractor and then does some craniopathy, which is a very interesting technique where he will measure the cranial plates and just kind of the fluidity of how the neck is moving and the spine. And what he has found is that when someone is thinking about a trauma that they have been through, he can actually feel this tightening, this dura mater sheath tightening. And then when he has them not think about it, the range of motion and the pliability of these, the plates in the skull essentially would be more movable. So found that was really interesting. And so then he really got into utilizing this type of brain spotting also with his clients, but in just not necessarily as much in the psychological way, but just more the like, hey, think about this traumatic experience, and then let's try to manipulate your cranial plates and your skeletal system to get your body to keep the adjustment. Because, I mean, typically when you do ask someone, it's like, yeah, so when you go in and get a cranial or chiropractic adjustment, how long does the adjustment stay? And they'll be like, oh yeah, well, in a couple days, sometimes it goes back out of place. It's like, well, this is why. He talks about that we don't deal with the psychological component, so therefore the body doesn't actually adapt into a calmer state. It's still staying all ramped up in this duromotor torsion and that hypervigilant amygdala, increased homeostasis. And then the fascia. So I briefly talked about it with Dr. Peter Levine's work of somatic experience. He knows that we hold on to traumatic memories forever in our fascia, and therefore we need to allow for the fascia to have that experience to process its negative and adverse experiences. So kind of interesting stuff. Certainly individuals in the psych world have heard of some of these concepts. And so this was a Dr. David Grand's concept around, and he wrote This Is Your Brain on Sports. It's a book that came out, about 7 years ago, but he's been written about in multiple of the sports psychology textbooks and so on, of really understanding that sports trauma or trauma creates a network within our brain and our body. And so we encounter one trauma and we react a certain way, lay down a memory network out of survival, that kind of primitive brain, whether it be that torsion, that hypervigilance, going into battle, muscle guarding. And over time, the more traumas that we encounter, particularly when we're looking at athletes, and we're talking a physical trauma is as simple as hitting a ball to the extent that the kid for a second hears some ringing in their ears or something. It's like, hey, that was enough to jostle the nervous system and kind of lay down one of these memory networks, or even getting knocked down, the same kinds of things. So as time goes on, our trauma memory network continues to increase. And so every time we experience one trauma, then we're actually going through the entire memory network of the other ones, which then causes us to be, again, more hypervigilant, more susceptible to the sympathetic nervous system and or that fight, flight, freeze all the time. And so again, that sympathetic nervous system, the fight, flight, freeze, those are a lot of our symptoms of what we call anxiety, or the parents bringing the kids in saying that they have a panic attack going on. It's like, yeah, that's their trauma memory network is quite large and their reservoir is full, as we say. So a lot of trauma specialists and experts, Dr. David Grand, Dr. Bessel van der Kolk, he's one of our more popular ones that talks about this, Gabriel Malte, but they all talk about how this trauma reservoir gets full of this undischarged trauma, and we need to discharge this trauma, right? And again, so we're starting to look at the symptoms of this hypervigilance, the anxiety symptoms, all of those things start to come when our trauma reservoir is full. And then we start to get into, the depressed nervous system. So Dr. Drkutcher, MD, he is our team medical doctor for our United States Olympic team, for one, but he also works with our National Basketball Association, he works with our National Football Associations, and the player associations, right? So the individuals that are in charge of making sure these athletes get put back together and taken care of even after they're done playing, right? And he also runs the whole sports concussion wing of the American Academy of Neurology. So he's quite brilliant individual, cares so much about athletes, shares his work all over the world, and has been written about in many of these concussion consensus around the world of like how we're treating youth concussions. And so he really talks about, if it's a brain or body injury, he has seen over and over that athletes will become depressed no matter what, right? And it's just really, we're in that fight, flight, freeze, primitive homeostasis when we're injured. And whether that be concussion, physical injury, or even just a trauma, if we're appropriately grieving things, we will be in kind of a depressed mood and have a depressed nervous system. And oftentimes when we're talking about depression with athletes, sometimes they like to know that, like, yeah, I had an injury. No wonder I have these depressed symptoms. Oh, yeah, I had, where there's an up, there's a down. That's Dr. Daniel Amen's work. He's an MD psychiatrist here in the States as well. And he really talks about 70% of his cases of anxiety, there's depression also, because where there's a up, there's a down. So really interesting information and just some concepts here. Again, when working with athletes, it's going to be a little different because there is that physicality piece there. And I'm not saying everyone isn't immune, or whatever. We all have adverse childhood experiences, but we know this can get amplified in these young athletes with the life experiences and then these physical traumas or injuries. And so when we talk about shaking things off, right? So animals are not like us. So animals have the ability to, they'll sit there and make sure the trauma's over or the scary thing's over, and then they'll instantly shake it off. They just don't hold on to it. And this is my Daisy dog. I sprayed water on her. She didn't like that. So it's a good concept for educating our parents and our athletes and everyone around how we deal with trauma. And so I'm always talking to them about like, all right, so we need to find a way to allow for you to shake this off, is kind of what I say. And it gets to be kind of cute when my 16-year-old athletes come through the door and they're like, oh man, I had a bad competition. I just need to shake it off. It's like, all right, yeah, let's do the work and get it out of your nervous system just like the animals are capable of doing. And so when we talk about the factors influencing mental illness in athletes, again, same kinds of things that I was talking about before with, the life stressors and traumas, any kind of family system stuff, and even generational family system stuff. We know a lot of times with athletes of color within our sports systems, they are already dealing with, especially in America, that other already a hypervigilant amygdala, hypervigilant nervous system, because we know that 7 generations down are negatively impacted from pretty severe trauma. So we're still kind of dealing with a lot of that. So depending on your client's race and ethnicity and all of those components, we can already be dealing with going into a hypervigilant amygdala around that component. But certainly any family system stuff, parents divorcing, a parent who's an addict, or even just a pretty tumultuous family environment, and even competitive. A lot of times in sports families, they'll be kind of pitting their kids against each other, and so that starts to become a pretty unsafe environment. So already, again, we start to get this hypervigilant amygdala, and then we start to get these anxiety depressions, and then the potential for the depression symptoms. So poor, inadequate nutrition, huge with young athletes, huge with our youth right now when it comes to social media. It's terrible. We've got a lot of really inaccurate dieting kind of stuff out there, and just not great when it comes to the messaging around fueling our body. So there's that piece too that can already be traumatic. If an athlete's not eating enough, their nervous system's already going to be in high alert and really burning the adrenals, as opposed to allowing for that proper nutrient absorption and calorie utilization. Then, like I said, the physical traumas, injuries, and even surgeries. All families contact me and say how their kid isn't sleeping and how they're too afraid to do the sports, and they have all this performance anxiety, because that's a safe word in the sports world to say performance anxiety. Nothing's wrong with you if you have that. And I'll be like, well, what's going on? Well, they had to have, tonsil and adenoid surgery, and then they had to have, deviated septum surgery. I'm like, wow, no wonder. So there were some other traumas there that weren't necessarily related to sport and weren't necessarily family systems traumas, right? Overtraining syndrome or inadequate sleep. Well, this is huge now. Back when I was like an athlete and working in athletic training room and all of that, we barely talked about sleep. So it's like we were aware of overtraining syndrome when we were talking about like just training too much, or if they, were still sore beyond the 72 hours of the delayed onset muscle soreness. But really this inadequate sleep at this point in time, there's a lot of really high-level sleep specialists in the sports world talking about how it's not necessarily always overtraining syndrome. It could just be that they're not sleeping enough. And so we really want our athletes sleeping 8 to 10 hours, but those things can start to push these symptoms and get that hypervigilant amygdala, and then so it's like exacerbating what was already a negative symptom, because they lay down and then their heart is racing, their mind is racing, and they can't sleep anyways. So you start to get like, which came first, the chicken or the egg with that. And then watching or witnessing other athletes become injured or endure performance failures. So this was really an interesting one to me that I didn't really understand until I started to learn more about co-regulation and coherence, and how that we do, they've done these studies where people sit with QEEGs on in a room, and one person will be talking about something emotional, and sure enough, other individuals in the room, their brains will light up in those certain areas. And then we also have seen the studies now where they will do things where, you're causing pain, it's just slight pain, a prick or something to the hand, and everyone else in the room, again, those areas of their brain where that feedback loop of the communication to the hand, that lights up. I'm like, this stuff is amazing. So that's a big one when I'm educating parents and coaches, particularly of why the kid's nervous system may be dysregulated, right? So really interesting stuff there. And then also, and as with the Olympics going on right now, it's like, oh my gosh, every time I tell my athletes, I'm like, don't watch anyone else. We want you off by yourself, doing your own nervous system positive performance conditioning prior. We don't want to watch anyone else fail, because then sure enough, your body will go into this hypervigilance, like, oh my gosh, I don't want that to happen to me, even if you're not completely consciously aware. And that has to do with how dangerous the sport is too. I work with some really extreme sport athletes sometimes, like snowboarders and freestyle mogul skiers, and some of these things that we see, really negative crashes and some of that stuff. And so a lot of the work that we do will be working on the stuff that they know could, the worst case scenario, they know what could happen to them. So you're really desensitizing an individual to those things so that their nervous system isn't on high alert all the time, and they can actually regain that control on the outside of their brain to do their performance, but also so that, again, it decreases these symptoms. We do not want anxiety or depression symptoms. So, in what I've been talking about a little bit, Polyvagal Theory, right? So Dr. Stephen Porges, he's an American professor and has this whole polyvagal theory where he talks about how we have two ends of the nervous system here with the sympathetic nervous system and the parasympathetic nervous system. And what, I've been kind of, I guess, alluding to at this point in time is that we do not want to be living in our sympathetic nervous system all the time, right? So as we start to get into our fight, flight, freeze up there, that's where some of those symptoms are going to start to show up of the anxiety, the fear, the worry, stress, whatever languaging your client is utilizing, and then to the degree that it's impacting their life, right? And so you see here with the line where I talk about the injuries, the multiple injuries, and how it continues to ramp up an athlete. And this is just typically what I see. Concussions are like way worse sometimes with this stuff. We know 60% of the time that an athlete will have sleep disturbances, or just an individual with concussions. There's a lot of athlete and our military studies on concussion because they're kind of a control group so that we can measure and monitor their treatments. But a concussion will really cause more sympathetic nervous system dysregulation and can really send someone into not being able to sleep. And again, I use the Hamilton anxiety scale, which I'll be showing here. And so sleep is really one of the ones that I zero in on to see where they're at with that. Are you falling asleep? What's going on with that? Because I find that, again, we really need to be telling and educating our clients that it's like, if you're not sleeping, you are not functioning healthfully. We need 8 hours of sleep to refuel our brain chemicals. And we know now from some of the neuropsychologists and so on that are doing all the concussion work that at 5 hours or less, we already have neuroinflammation going into the day. So scary, scary stuff. So here's, just kind of what all this sounds like. I'm sure anyone can read any of these, but you start to hear all these things from these kids. I'm like, oh, I want to quit. I'm mad at my teammates, agents, parents. Just all these kinds of negative thoughts that come through. And I'm sure the parents can acknowledge, like, yeah, they get into the car, I just want to quit, the coach hates me, just on this high level of, upset emotions following a game. And then the other thing about they keep getting injured. So that's kind of an interesting thing too, is that, and I started to kind of look at these things and being a sports trauma expert, and especially really high-level skiers and snowboarders and stuff, it's like, wow, they will consistently get the same injury over and over. It's like, well, the body's reacting maladaptively to it. It's like you'll just continue to see that until you break down this pattern and finally address with sympathetic nervous system dysregulation. So when we talk about the stuck-on symptoms, I kind of went through a few of them here, but, the performance anxiety, the persistent pain while playing, the total blocks and yips and balking, if anyone has never seen those, they're just fascinating. It is that, a athlete or performer or player, in baseball, they just want to be able to throw the ball. It's just the body just shuts down. It just won't even let you throw the ball. It's fascinating. So when we're stuck in the sympathetic nervous system, that's where we are. And so often athletes will quit, whether they be kids or college or professional, they'll just quit because it's so confusing and they don't know why that's going on. And then, of course, just our normal kind of stuff here. I talked again about the insomnia. It's just so important to me. And then, what's funny too, you'll see if someone's really in a sympathetic state, like especially when you're watching football or American football and these kinds of things, and you'll see a quarterback and they're like throw real wild, and you think like, wait a second, they should be able to do that in their sleep, and they should. Same thing with like golfing. It's like people should be able to do their performance in their sleep because they've done it so many times. There's so many neural pathways associated with that. So it's really when they're stuck in the sympathetic nervous system that you start to see these things happening. Yeah. And so then we talk about the sympathetic to crash. So this is interesting too. So I've seen, a lot, I don't know, probably like mid-20s to mid-30s individuals who are like big college athletes or past professional athletes, and they're now in the states where they have like all of these chronic mystery illnesses going on, and I just feel terrible for them, and it's just very common, essentially. They've pushed their body, they've pushed through the sympathetic nervous system state, they've just lived there, they've lived on 4 hours of sleep, they've overtrained and done all these things and achieved all these fabulous things in their life, but then we get this crash. And you can even see this with your high schoolers too, because they start to play in the US, we start to play sports at like age 5 is when they really start to push these kids with travel teams and some of these things. So we will start to see this crash. So, and again, anyone just out there who's like, well, I'm not an athlete, but this is average people too. You go through a few deaths in the family and a few really difficult university degrees and all these things. You can certainly push yourself to this crash as well. Oh, and then we kind of talk about the brain waves. So shift a little and talk about the brain states and where we're at. And so I do QEEGs. And so oftentimes when I'm, measuring someone, I'll be looking at the beta-theta ratio. And so the beta is kind of our anxiety, alert, awake, but I kind of see a high level of anxiety, with this beta, because of course we can do a brain scan and a person may say like, oh yeah, I don't have any anxiety, and they could potentially just be downplaying it or have more of that arousal in their body that they're just not completely aware of cognitively. But yeah, so looking at the theta-beta ratio, we really want people in the theta, and so when we measure someone and we see that they're up in this beta all the time, that's again where some of these sympathetic nervous system symptoms come in. So I like to see people down in that alpha. That's kind of like their flow. And so again, your clients will understand this stuff if you're explaining to them why you're doing what you're doing. Because we know the placebo effect's huge as well with anything in life. We really have to take to something and understand something and then know why we're doing it and how it's impacting us. Oh, and then so the flow, when you're talking to these kids about essentially when was the last time you felt this way? But this flow state is really where we want to be. We want to do this in this place in all areas of our life. And you kind of think back to like, oh, when was the last time I felt this way? It's like, oh, maybe when you were a small child, if you haven't done a lot of work to deregulate your amygdala and clear some of these past negative things. But just looking at when you're doing your assessment in the beginning, oftentimes kids are not in this state, but after treatment, they certainly are. So it's good. And so then the parasympathetic, and just kind of telling kids, these are some other measures that I'd like to see. And parents, this is what I want to see with your kids, and parents too. The parents need to model also. Yeah, let's all get enough sleep. Okay, so in talking about, so I gave a lot of background just because I'm going to be referencing some of the languaging and so on, and like I said, just education, psychoed, why we're doing what we're doing. And so my techniques that I utilize and have been utilizing for about 10 years now and see really interesting results with individuals, athletes, is the brain spotting, and I use the binaural frequencies with the bilateral sounds. I'll get into that in a minute. And then the audiovisual entrainment and cranial electric stimulation, and I use the Mind Alive device, a really great device out of Canada, and then photobiomodulation. And I use the InLight therapy device, and it's these polychromatic light therapy pads that we actually put into a helmet to put on a kid's head, and then we put a pad on their stomach, and then another pad down their spine. So these are the things that we're doing. Brain spotting. Well, this is a few years ago. This was a U.S. ski teamer who I sponsored. So there's photos of him. It's nothing. Very talented freestyle mogul skier. And so when I first started my practice and working with him, this was all about statistics and kind of looking at that. We didn't look at a lot of, anxiety, depression kinds of things. It was really just to get back on the podium at a national level. But this is him practicing the brain spotting. And so we're going to break down what we're kind of doing here. So we listen to binaural bilateral sound. I choose binaural because I know that it entrains us and gets us back down to that theta wave and down to the parasympathetic, right? Then also the bilateral is the side-to-side sounds, very similar to hypnotherapy. So we want to put the sounds on someone, we drop them into more of that middle brain state where we can make good changes. And unlike hypnotherapy, brain spotting is more client-led as opposed to therapist-led, right? I have training in hypnotherapy, but it's not that process. It is just utilizing that bilateral sounds that way. Then we can cover one eye or the other. We know that the eyes operate independently, particularly when I'm looking at trauma and sports trauma and trying to get someone's nervous system to calm down. Sometimes if I just work on one eye, I will see that I don't get as big a shift on the QEG as I would in QEG Brain Scan as I would with the working with both eyes and making sure I do both one at a time and then both together. Kind of interesting stuff. I've seen more performance issues, meaning individuals not landing tricks perfectly or slowing down on the ski hill if I'm not manipulating the eyes by covering them more. So that's just a little side note, not necessarily a big component of the anxiety depression piece. And typically I see a shift in their mental health before I see a sports performance result. And what that tells me is that we are dealing with the cognitive anxiety piece and that and then the arousal piece comes after. So yeah, so and typically, I work with someone about 8 to 20 weeks or so, and so we'll see that in some of our case synopsises here real quick. But back to kind of what we're doing here, so covering the eyes, and then we also have this pointer. So, with the pointer, it's that eye movement reprocessing desensitization piece, right? So we have the hypnotherapy piece, we have the eye movement reprocessing desensitization piece, and what we know with that is that if we are moving a pointer back and forth, we have seen that that is an effective way to release the brainstem and the nervous system from trauma. So pretty cool. There's quite a bit of literature on EMDR. Brain spotting has only came about in about the past 13 years or so, and he was an EMDR trained, Dr. David Grand, EMDR trained, hypnotherapy trained, neuro-linguistic program trained, somatic experience trained, focused mindfulness trained, very talented individual who put components of all of those therapeutic modalities together to create this kind of superpower therapy, which is really cool that I get to talk about these cutting edge therapies with all these individuals from around the world, because I hope that they go and get trained because they're really remarkable, or get a session on themselves. But nonetheless, so the EMDR, and then what we will do is, for example, is sitting in session with this individual, I would sit there and have him start to tell me about, his competition coming up, right? So he's worried he's going to crash or this or that. So there's that anxiety. And as you do that, you move the pointer across and you're trying to find a reflexive wobble in the eyes or the body shifts where it will tell us where we need to hold it in place to fully address that nervous system dysregulation, as we'd say. So it's a reflexive cue. And then we sit there and then we have the individual go through the worst case scenario, what can happen, what has happened in the past, they're worried about happening again. And then you ask them, well, where are you holding on to this in your body? So that somatic experience piece and that focused mindfulness piece, then we have them sit there and fully process it. So they will verbalize like, oh, I'm worried about crashing when I hit the bottom air because I've crashed before, and then they will go into more of, okay, so going ahead and holding this gaze onto the pointer, and I want you to really overthink how terrible that is and the potential of that happening, and just really as if you're there, sight, sounds, and smells. So really that focused mindfulness aspect in the moment. So this is kind of the thing with Dr. David Grand. What he has found and over the years is that we can really, brain spotting is a desirable condition to activate the feeling and the emotional part of the brain, and then it allows for us to fully reprocess and desensitize those encapsulated traumatic memories, right? And so that then we are no longer holding on to them, predicting that they're going to happen all the time. The application of brain spotting. So really, when I start to work with an individual, I want them to write out this laundry list, as we call it, of all the negative things that have ever happened, because what we're going to do is we're going to go back through those in the setup that I just showed you guys with the headphones on and the covered eye, and utilizing the pointer and having them follow that and stopping when we see weird reflexive physiological cues from the eyes and body, so that we can fully reprocess and desensitize ourselves to them. So what happens over time is then we start to no longer perceive these things as negative, and we no longer unconsciously hold on to this primitive muscle guarding reaction that they could happen again. We've allowed for the fascia to release. Really Peter Levine's work around the somatic experience piece. And so, and again, just saying here, this is the reflexive cue and it's a signal. And then the other thing that's been interesting with the eye position is we've got a couple different providers. That same chiropractor guy that I met him at the international conference in Brazil about 7 years ago now, and he just does some amazing work. But both he and Dr. Ruby Gibson, another individual, she does a lot of generational trauma work here in the States and working with Native Americans here, which is very interesting work around, like I said, a dysregulated nervous system from generations of trauma already. But what both of them have found, and I don't personally do muscle testing, as some people muscle test and you hold on to like certain supplements and stuff to see if your body wants them or doesn't want them. It's Dimitri Klinghardt. He's actually an expert here in the States. He's a medical doctor and has a Sophia clinic. He created some of this curriculum. It's kind of interesting to watch individuals do it, but they can actually muscle test by you thinking about the bad thing, the divorce, the breakup, and have you look in certain directions and then muscle test, and you will actually be weakest where we see the same physiological cue. So it is truly a weakness in the nervous system when we find this eye position. And there are multiple kinds of ways where we play around with the eye position, and with the brain spotting trainings, we're up to a level 4. And there are 3-day trainings. We have different kinds of specialty trainings. So it's really an art as you progress through learning how to do the technique and then being a client of the technique, learning different ways that we can direct you and allow for these reflexive cues to prevail within the visual path. So really interesting stuff. But yeah, just a little side note there, and just how cool the nervous system is, that we can identify these weaknesses and then fully process them and let them go. And then when you muscle test someone, when they're thinking about them, guess what? We don't have any more weaknesses in the nervous system. And Dr. Davis and I did do a few experiments on some youth athletes who came through his office at one point in time, and it was really cool to watch. And then, the other component with brain spotting that I find from a physiology perspective is that, oftentimes with trauma, mental or physical, we just don't want to think about it anymore. And it's super common with athletes and really high performers is that like, well, I just don't want to think about it again. It's over, it's done, I just don't even need to. Well, that's not true. It's still there. So when we talk about the overload principle, we go back through it over and over and over again to strengthen that nervous system, desensitize that nervous system so that that event, potential event, or the thought of that event happening again will not trigger our nervous system to go into that sympathetic state and produce those negative symptoms. Photobiomodulation and the laser LED light therapy. So this is what it looks like. I held up the little pads, and then you'll also see that little box there is the audiovisual entrainment. So this is an athlete in my office, and he has the light therapy on, and on his head, on his tummy, and on his spine, and his hands, hold emotions in our hands, so I'm always spinning the hands. And then we'll do the audiovisual entrainment, which is just flashing lights and sounds, and just a brief, the light therapy is really cool. There's a ton about light therapy right now. I mean, it heals bones 50% quicker. It's really effective with concussions, but I find that it's amazing in stimulating the release of nitric oxide so that then it combats that cortisol stress, and then it's increasing the blood flow, so it's getting the nutrients where they need to go. We know that it increases dopamine production. Really cool stuff. So love the light therapy, and it's just 20 minutes. These self-administered little systems, if you're a provider out there or whatever, you need to get a system. They're great. But yeah, just 20 minutes. It goes on its own, and you can Google and find, there's over 5,500 peer-reviewed studies, and I certainly have ones on my website too that you guys can check out for the brain particularly. And then me modeling the randomized audiovisual entrainment, cranial electrical stimulation, just doing that. So flashing lights and then sounds that are calibrated at multiple of the brainwave frequency, right? And so there are already preset programs so easy, dummy proof, or whatever you want to say. Anyone can utilize this device by looking at symptoms and then matching the symptoms and running the program. Just flashing lights and like a thudding, pounding sound in your ears. So really when we sit here and talk about what we're doing with these three modalities, it's the amygdala can be reset and the hippocampus gets stronger. So Dr. Damir Demoot, he's out of Amsterdam, a very interesting, neurologist. He's a neuroscientist and a psychologist, so he's got 2 PhDs, but he validates these, the brain spotting, particularly that modality, with resetting the amygdala. So very cool stuff. And then our homeostasis can be reset to a healthier one, so a calmer one. That's Dr. Robert Scar. And then Dr. David Grand says that we can decrease this memory network and decrease the potential to activation, HPA axis and thalamus. So David Seaver, the creator of the audiovisual entrainment devices out of Canada, he says that we actually, and I have seen this as well, that we increase the energy then to our glandular system. Because before that, if we do a QEG, particularly someone who's had a concussion, the HPA axis is knocked offline. There's no energy coming there. We need our HPA axis in our brain. We need that energy. We need our thalamus functionality. But with the audiovisual entrainment, that is restored. Some really cool stuff. And then, of course, like I said, the photobiomodulation, Dr. Michael Homblin was the first one to study it here in the States, started in '93 at Harvard, looking at the photomedicine on the brain, but bringing back that blood flow pertinent. And so here's QEG Brain Scan, pre and post. So this is just one session, and very, very clean. This is just one session, one incident, not the typical 8 to about 20 weeks I'll work with someone. But we want the changes to stick, and we want them to be sustainable. But this is pre and post, and this is beautiful. That's what we want. And then again, when we're looking at audiovisual and physical reaction time, we see that increase. We see the voltage in the brain increase, all these good things that we want. We see the theta-beta ratio decrease. Because like I said, so we don't want that window really big. We want it to be smaller. We don't want to go all the way up to sympathetic and then come down all the way. We want it to be more in that flow state, in that positive brain state. And same thing, just this is regional. This is the head. So we know that our reaction time is increasing, audiovisual and physical. So that's amazing. That's brain functioning. Of course, with athletes, that's everything. And then so I talked about using the Hamilton Anxiety Scale. So this is, when we're looking at the numbers here, we know that someone has anxiety when they're all the way up into the, it can go all the way up to 56, which I've seen, but I have all my kids do this. This is also built into my QEG Brain Scan. And yeah, so a little case study here. We had a pre, it was 38, the post was 8, did 10 weeks, and again, not a picture of the individual, just a random picture, but it was a 17-year-old basketball player, came in with persistent knee inflammation, had a broken pinky. Again, I care about the injuries, and what we did was 10 weeks of the trifecta. So the brain spotting, photobiomodulation, the audiovisual entrainment, and we used the left brain activation on the audiovisual entrainment, because persistent performance anxiety, and again, when we break down the Hamilton anxiety measure, we can see if that sleep one's in there, really big one. 18-year-old hockey player, so similar kind of stuff here, 45, 3 concussions, everybody knows them, so there was that kind of wow, no wonder you have so much sympathetic nervous system anxiety symptoms. So again, just looking at, we did 12 weeks, he'd had a broken wrist that required surgery, so again, to me, this is wow, broken collarbone is a lot of trauma. And so, yeah, and then, so we do 40 minutes of brain spotting, then throw them on the table with their audiovisual entrainment and photobio. Gymnast, same kinds of things. So 42, 12, again, this Hamilton scale. It's a really good scale to just throw out there to everyone, your clients, to kind of see your effectiveness of decreasing those anxiety symptoms. Yeah, so volleyball player, plantar fasciitis, persistent injury, so we know that's kind of a sign that we're living in that sympathetic. This was a pretty intense one. Again, most of my skiers have had pretty intense crashes, and so 2 pretty bad concussions, this individual. And any of these individuals, when life gets stressful, then they reach back out. I'm a tune-up kind of treatment provider, so when they need me again, they reach back out. And then I'll do monthly, sometimes tune-ups, depending on what sport they're in. But yeah, but we're able to really, and this we did the right and left, and then both together is what the chart said. But we're looking at the symptoms. Are you feeling more anxious today or more depressed? And so that would dictate which one of the David programs we would do. Yeah, so reach out to me. I love the opportunity to really talk about brain spotting, photobiomodulation, audiovisual entrainment. I have a lot of info on my website, and photobio and the audiovisual entrainment, anyone can own them at home. There's no negative, outcomes or risks. So yeah, reach out if you're interested at it in your clinic or your home or any of those things. So thank you for having me.